Atrial fibrillation is probably the commonest rhythm disorders that we deal with as cardiologists. It is increasingly common as you get older, and we're blessed that our population lives longer now, so we see more of it. If you have atrial fibrillation, it can occur even without symptoms. So your GP felt your pulse and it was irregular. That might be atrial fibrillation, an irregular beat that we then prove by doing an electrocardiogram, an ECG. But sometimes it is also symptomatic, and especially if you're younger. If you're young and your heart becomes a bit more chaotic, you are often aware of a fluttering, a jumping of your heartbeat into your throat, a feeling that you can't exercise as much. And that may all be related to this rhythm called atrial fibrillation. Normally, the top chamber contracts and followed by the collecting, and that's a collecting chamber, and then the pumping chamber contracts. That coordination provides the best blood pressure and cardiac output. In atrial fibrillation, the top chamber is actually not contracting properly, it's just wibbling. And although the heart still functions, it doesn't function as efficiently. So not only do you feel that fluttering, that wibbling, you also may not be able to exercise quite as much. So that's what atrial fibrillation is. In terms of what we can do about it, there are two strands. We either try and control the heart rate, which is very effective in older people, or the heart rhythm, and reset things back to normal sinus rhythm, which is more effective in younger people. The second strand of it is that atrial fibrillation can lead on to stroke. And so we need to thin the blood if you have other risk factors for stroke, such as being older, if you have diabetes or high blood pressure or coronary disease, or if you've got heart failure. These are important things. So the two strands of treating atrial fibrillation are decide on whether the rhythm or the rate need to be controlled with one set of medication, and stroke prevention with blood thinning medication.